Hi, I'm Dr. Allyson Jang. Do you dismiss thoughts about gynecological cancers because you feel you're too young or don't have a family history? Or perhaps you feel helpless thinking there's nothing you can do to prevent them? Today on Ask the Expert, we're busting major myths about who's at risk and what you can actively do. Let's get started. Myth number 1, gynecologic cancers only affect older women or women with certain risk factors, like a strong family history. Young, healthy women don't need to worry. This is a dangerous myth. While some gynecologic cancers, like endometrial, are more common post-menopause, others, like cervical and even some ovarian cancers, can affect younger women. And the idea that you need a family history to have these cancers on your radars is often false. Most women diagnosed with these cancers have no family history at all. It's about being aware of your body and getting regular checkups, no matter your age or your medical history. Myth number 2, there's nothing I can do to prevent gynecologic cancers, so why even try? This is simply not true. While not all gynecologic cancers are entirely preventable, there are significant steps you can take to reduce your risk and, importantly, detect them early, which drastically improves outcomes. HPV vaccine dramatically reduces the risk of cervical cancer. Regular screenings, PAP and HPV tests catch cervical cancer early. Healthy lifestyle. Maintaining a healthy weight can reduce endometrial cancer risk. Women who are obese are 2 to 4 times more likely to develop endometrial cancer than normal weight women because fat can change hormones into estrogen, which then stimulates the uterine lining. And then knowing your body. Even subtle symptoms for ovarian or endometrial cancer can lead to early diagnosis. So yes, there is absolutely a lot you can do. Myth number 3, a regular pap smear can detect all types of gynecological cancers. This is a very common, however, harmful misconception. The pap smear is a fantastic tool, but it's specifically designed to detect cervical cancer and precancerous changes on the cervix. It does not screen for ovarian, uterine, vaginal, or vulvar cancers. So while it's vital for cervical health, women need to understand it's not a one-stop shop for all gynecologic cancers. Staying on top of other cancers comes down to personalized care, knowing your risks, discussing any concerns with your doctor, and for certain situations, specific imagings or biopsies might be necessary. Myth number 4. Ovarian cancer is truly a silent killer that has no symptoms and can't be found until it's too late. While it can be more challenging to detect early, ovarian cancer is not always silent. It often presents with persistent, subtle symptoms that can be easily dismissed. Things like bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, changes in urinary frequency or urgency, changes in bowel habits. If these symptoms are new, persistent, and worsen, it's crucial that you speak with your doctor. If you're told it's just IBS or aging and symptoms continue, get another opinion. Awareness of these whispers is our best tool for early detection. Myth number 5. Endometrial or uterine cancer only affects women who are older and postmenopausal. While the risk certainly increases after menopause, and postmenopausal bleeding is a classic warning sign, this cancer can absolutely affect younger women. We see it in women who are premenopausal, particularly those with risk factors like obesity, polycystic ovarian syndrome, or a history of irregular periods. Any abnormal bleeding, heavy, prolonged, or bleeding between periods, regardless of age, should be investigated by a physician. Don't assume you're too young for it. Number 6, cervical cancer is no longer a concern because the HPV vaccine is widely available. This is a dangerous oversimplification and could lead to a false sense of security. The HPV vaccine is truly revolutionary and capable of preventing up to 90% of HPV-related cancers. And while it is one of the best tools that we have in cancer prevention, it does not eliminate the need for ongoing vigilance. Here's why. The vaccine protects against most high-risk HPV strains, but not all strains. There are still other types that can, albeit less frequently, cause cervical cancer. Early infections. If someone has been exposed to HPV before vaccination or they're vaccinated late, the vaccine can't clear an existing infection. Access and uptake. Not everyone has access to the vaccine or chooses to get it. We still have many women and men in the population who are unvaccinated. Time lag. Even with widespread vaccination, it takes decades to see the full impact on cancer rates. While we have already seen a decline in the incidence of cervical cancer, we still have a long way to go. This is why regular pap smears and HPV co-testing remain absolutely essential, even in vaccinated women. They are our safety net, designed to catch any abnormal cell changes before they turn into cancer, regardless of vaccine status or HPV exposure. My message is simple: know your body, know your risks, and do not hesitate to speak up. If something feels off, if you have persistent symptoms, or if you just have questions, talk to your doctor. Early detection saves lives, and your health is worth advocating for.